Hey everyone, welcome to the very first episode of They Don't Tell You, Pregnancy Edition. I am here today with Dr. Tom Padilla. He is the founder and owner of the Doctors of Physical Therapy here in Scottsdale. And I wanted to bring you on for my very first episode for a couple of reasons.
I feel honored.
Oh, thank you. Yeah, you're welcome. We did a podcast together about a year ago on Ethos athletes, and we did a special kind of pregnancy and low back pain episode. And you really planted a seed with me at that time that I've carried with me for a while, and it's kind of blossomed into this YouTube series. Just because something is common doesn't mean it's normal. Right? And I think I see that all the time in my practice. Patients come in and they've been dealing with a symptom for ages. And because their mother has it and their grandmother had it and their aunts experienced the same thing, it must just be a part of life, right?
Or hereditary.
Yeah. And it's not. You don't have to live that way. And that's really kind of given birth to this series of, taking charge of your health during pregnancy, knowing the questions to ask and being able to kind of be more proactive and not have to deal with these things that are normal. Right? And then the other reason that I, this place is near and dear to my heart, right? I met you after my first pregnancy. I had suffered with pretty significant back pain through my first pregnancy and afterwards. And I started working with you and the doctors here at the office, became pregnant again, and it was a completely different experience. I didn't suffer from back pain, and when things would pop up, I would actually be able to come in and say, hey, this doesn't feel right, let's address it. And right away, with some manual therapy, some targeted exercises, that pain was resolved. So
Great.
It's hugely powerful. So it's really special to have you on at this first episode.
Well, thanks for having me.
Yeah, absolutely.
Anything we can do to make pregnancy less miserable or almost enjoyable, is a great service.
Yeah. So I just want to start off with talking about low back pain, right? It happens in 50 to 80% of women during the course of their pregnancy. Can you talk to us kind of about what joints are most affected during pregnancy and kind of why we see back pain pop up at this phase of life?
Yeah, absolutely. So I think the number one joint most affected during pregnancy and low back pain is your SI joint, right? So your SI joint is made out of your sacrum, which is your tailbone, and your ilium, which is your pelvic bone. So they sit together like this, right? And they have a little bit of degrees of freedom. They should move a little bit, but the problem with the joint, because it's so irregularly shaped, is that it can actually get stuck out of place. And when it gets stuck out of place, that creates different muscular patterns and different instability issues, which your brain interprets as looseness or instability, and it starts to tighten up all the muscles around the area. But now you've got a loose joint that has tight muscles around it, so you get a lot of compression and grinding, which starts to cause inflammation, and over time that causes pain. And one of the reasons that crops up more so during pregnancy is because your body, as you know, is releasing hormones, which is preparing you to pass a child, which requires the pelvis to open, right? So those ligaments are holding bones to bones, and they need to allow those bones to separate a little bit. Now, part of what happens is with our mostly sedentary lifestyle, right? A lot of people are at work 6 or 7 hours a day or 8 hours a day, and they're doing things that are putting pressures on the bones that are causing little shifting throughout the day and stretching those ligaments in ways. And what happens is, as you're doing that, it shifts those bones out of place because the hormones are being produced that allows those bones to be shifted out of place, and then the bones just get stuck like that. And so over time, that's exactly why you start to have SI joint pain, or it can even be from an injury or dysfunction that you had 3 or 4 years prior, right? So in your case, when you first met, right, you had already been through your first pregnancy, and in theory, this may have happened during your first pregnancy, and you start having pain that lasts well into your second. So you can have that pain that crops up because of something that happened years prior as well.
Yeah. So you kind of touched on the hormonal aspect, right? And I think one of the most, maybe not commonly known, but the one that's causing most of the problems here is relaxin, right? Which does exactly what its name implies. It's relaxing all of those ligaments to, as you said, allow for the pelvis to have that expansion, to allow hopefully for a vaginal delivery and childbirth. I think most people assume that that hormone isn't released until kind of right before we deliver, right? And that's unfortunately, or maybe fortunately, not the case. You don't want a rapid expansion of those ligaments. That would cause a lot of irreparable damage.
Right.
And that production actually peaks in the first trimester. And it does a bunch of other things that we don't need to get into. But women start experiencing pain and this laxity kind of in that second trimester and then into the third, which is then compounded by this shift in body habitus that we have, right? Yep. So you're growing a bowling ball on the front of you, which necessarily moves and changes your center of gravity, right? Right. So can you talk to us a little bit about how that affects that kinetic chain and kind of what's going on there?
The actual growth of the child and everything? Yeah, absolutely. So, I mean, aside from having this weight that you're carrying when your abdomen is expanding, you have a child that you're growing in your uterus, clearly, and what that is doing is pushing your transverse abdominis, which is one of the deeper muscles in your core, into a wider and wider position. Now, one of the things that we know that happens with muscles is as muscles get stretched, they actually become a lot weaker, just naturally. So if you're not doing things to actively try to maintain that muscular strength, what that's going to do is create not only imbalance from being thrown off by this weight, but your core can't contract in a way that keeps your center of mass over itself. So what ends up happening is your back starts to extend a little bit extra, more muscles start being used in order to keep you in that upright position. So you start to develop pattern dysfunction, which means that you're using the wrong muscles to do the wrong things because that expansion is taking place and you can't actively use your core.
Yeah. So one of the things that we've talked about kind of ad nauseum, I think, childbirth is an athletic event, as you like to say.
Yes.
Yeah. Which is absolutely a fair statement.
I think the whole of pregnancy.
Yeah.
Plus the childbirth.
Yes. Yeah. So it's like, let's run a marathon and then let's have a really intense sprint event at the end. And I think one of the things that we don't consider is being kind of conditioned for that, right?
Right.
So we go from this sedentary lifestyle where we're kind of sitting a lot of our days, and then we're expecting all this added demand on the body to just kind of happen, right? So when should a woman kind of seek help, I guess? Should they wait until they're having pain, or should they be a bit more proactive about that?
Yeah, I mean, absolutely. So one of the things that's interesting to consider is that people have to go through physicals for a job where they have to lift like 30 to 40 pounds, right?
Yeah.
But there's nothing that prepares you for this job that's 9 months long, continuous, and having to carry this weight around with you, right? So a lot of the times, even getting your structure evaluated early on in pregnancy or getting your muscular function and weakness and range of motion checked out would be a logical thing to do, but that's not a very common thing to do.
Sure.
So I think the most important thing to do is if you do have any sort of back pain or hip pain or things going on prior to pregnancy and you're planning on getting pregnant, it is a smart idea to get these things checked out and addressed and get on some sort of strengthening program and plan to carry you throughout your pregnancy with as relatively little issue as possible, or perhaps even resolving those issues completely and not having any issues throughout your pregnancy.
So I kind of want to circle back to, you mentioned the transverse abdominis.
Yes.
Is that the only muscle we should be considering? What is the core?
Right. So as you said, most people think it's just the six-pack.
Yeah. Right.
Muscles,
so there's this kind of false narrative out there that you got a six-pack, you got a strong core, right? Talk us through why that has nothing to do with the strength of your core.
Gladly. So where it all kind of starts is the pelvis, right? Yeah. That's where most of your force gets transmitted as you're walking and doing a lot of your daily activities. I like to separate the core into multiple layers, if you will. So you've got the deepest layer, and that's responsible for doing several things. It creates a pressure inside of your abdomen, which regulates your nervous system and your breathing patterns and reduces anxiety and things like that, or stress. And that's made up of your transverse abdominis, which wraps around your body like a corset. It's made up of your diaphragm, which forms the roof, then your pelvic floor, which forms the basement, and then your multifidi that run up and down your back. And these are the muscles that are responsible for stabilizing our entire skeletal structure during normal daily function, right?
Mm-hmm.
We're reaching for things, we're walking. It's not something that requires your rectus abdominis, which is the six-pack abs. It doesn't require a lot of your obliques and things like that, all the big muscles that attach to the pelvis. And so when it comes to the core and what muscles are most important for maintaining all your function, we're talking about these deeper muscles that should be tonically active or always active and stabilizing the spine throughout all of your daily activities. And these are the ones that get mostly disrupted during pregnancy.
Right. And so, we've kind of talked about how pregnancy and the demands, internally, that internal to external expansion creates that weakness in the core, kind of creates some new muscular patterning. How do we deal with that, right? Like, how do we kind of repattern after we have, a delivery and start working towards normal function again?
Yeah, I think one of the things that we've talked about in the past is you brought up that some doctors recommend physical therapy after pregnancy or childbirth, right?
Yeah.
And gradually that's becoming more and more common, but it's still very under prescribed, right? And it should be a little bit more common, especially after a cesarean, for example, right? So once you have a cesarean section and all those abdominal muscles are cut through, you're not able to use it right afterwards, right? They sew you up and like you're pulling yourself over in bed and doing all these things to try to work around not using those core muscles. And what happens during that period of time is your brain learns workarounds. And over time, because it's been so long since you have felt normal, because you just went through 9 months of carrying a child, the patterning that's learned during that time, you start to feel like that's what normal should be, right? And because the brain is now hardwired into that pattern and it doesn't reset itself without structured programming to actually get that pattern back in place, you'd be astounded. A lot of people, I think, you might be able to share, is that they can't activate their transverse abdominis. You forget how to activate it after pregnancy. And unless you are actually taught how to do it, again, it's not going to be natural for you. So the only way to regain those patterns is to go through a program to reestablish those patterns, which of course starts with an evaluation of whether those patterns are actually even there or not.
One of the things, when I started working with your office, I had low back pain. I also have a diastasis. Those are both things that we were working on and considering. And I remember working with, one of the docs in your office at the time, and she kind of looked at me and she's like, okay, so, just engage your transverse abdominis, and, we're doing this. And I was like, how do I do that?
There's a muscle there?
Go.
Yeah.
And so, you make a really good point. It's not intuitive, and I think some people just assume, and it's actually kind of programmed into the way that we treat women after delivery. We deliver, you're sent home, you have your 6-week check-in with your doctor, and they're like, oh, good, you made it 6 weeks, you're still alive, cool,
good as new,
be free,
go back and do everything you used to do.
Should be fine.
Yeah, you'll be all right. Trust me.
Trust me, I'm a doctor. But, let's consider, if you have a vaginal delivery, that's a ton of trauma onto the body.
Absolutely.
It's a huge athletic event, as we've already said. It's a ton of trauma. And then, as you've already mentioned, a cesarean section is a whole other set of trauma to the body that we shouldn't be just expecting women to bounce back from, right?
Right, absolutely.
Especially if they haven't done any prehab or preconditioning. If we're waiting until we've already delivered and we're already having problems, it's not something that's just going to naturally, spontaneously resolve in that 6-week period. Right. There's no magic wand that your OB has that's putting everything back to its original manufacturer's settings.
Good as new.
Unfortunately. But
and on top of that, you're getting a child around.
Yeah, they demand to be carried for a while. It's a thing. No one tells you that. No. And addressing the way that you're even holding your kid.
Yeah, that's big too, right? A lot of people use the just put them on your hip and lean away strategy, and that over time develops different muscular pattern issues that cause a lot of hip pain, back pain, knee pain. A lot of that stuff arises because of that.
And you definitely favor one side, right? Because you start forming these muscular patterns that your brain then becomes habituated to, and it becomes normal to have that that mom lean,
Right, absolutely. Because you're probably using your dominant hand to do certain things, so you're going to put them in your non-dominant arm while you do those things, and that's going to be your habit over time.
Yeah. So let's kind of touch on the timing of when symptoms arise. We've already talked about 50 to 80% of pregnant people experience back pain during their pregnancy.
Right.
How about the aftermath? What are we looking at kind of down the road?
Yeah, I mean, well, this is an interesting, I don't know what the statistics are on this, right? But I do see, we do see a lot of women in our clinic that they were told that their back pain during pregnancy was normal and that it would go away afterwards. And so then they wait and they wait and they wait, and then it doesn't go away, right? And so they come to us and they finally figure out that like this back pain was never normal in the first place, and they didn't have to wait all this time. But then you've got a group of the population that had back pain during pregnancy. Then things seem to get better afterwards for a little while, and 2 or 3 years later they start having all of these issues, right? But because they are so far removed from the childbirth, right? That's 2 or 3 years ago. It's not associated. Whether it was a cesarean section or vaginal delivery, that trauma is no longer considered as something that could have caused this issue. But the truth of it is that these patterns, your body's great at adapting. So you have found ways to move that are non-painful in the meantime, but the tissue damage that is a result is building up, and then after it gets to a certain point, you're going to start having pain. So as far as we can tell, it can be immediately after the trauma, or these types of things are called insidious onset, right? They just kind of come out of nowhere, and they frustrate people because there's no one thing that you can point your finger at, right? And when there's no one thing that you can point your finger at, it's probably the traumatic event you had 3 to 4 years ago, right? That caused some things to be offset and caused muscular patterns to be an issue, and eventually ended up in causing pain.
So even longer, I think we see this pop up with women. I have a patient I'm treating currently. She's in her 50s, had 3 children, and through taking a thorough history, found that she experienced this type of pain during her second pregnancy.
Okay.
And never really made that connection of, oh, this is similar to what I was experiencing then, right? She's now in her 50s, has undergone more than one surgery. Treating imaging, unfortunately, and now she's working with me. We're treating her SI joints. She's going to be working with you in the very near future. She's already on your schedule. But it's that thorough history. It's the physical exam. It's the evaluating everything that's happened during someone's course of their life, to really kind of bring it back to, okay, where did this start? What do we actually need to address?
It's amazing how when you start interviewing people and they've got back pain and it's been 3 or 4 years, has anything happened to cause it? No. Have you ever had a really hard fall, like on your hip or on your tailbone, or like this is like transcending like not just like women after pregnancy, but like other people. A lot of time they're like, I actually felt really hard on my tailbone and bruised my bone or fractured it or did this like 5 or 6 years ago. Do you think that has something to do with it? And of course it all does. It's all relevant, the entire person's history.
So I want to bring up a issue that I know is a little bit of a soapbox issue for me, a little cringy word.
Let's do it.
I think you know where I'm going with this one. Sciatica.
Okay.
Right? I think in our field, sciatica has become kind of a catch-all phrase, right? What does sciatica mean, and what does sciatica mean?
What does it really mean?
What does it really mean?
How's it used?
So
when it comes to sciatica, it refers to an issue along the sciatic nerve, period. So that you know what the sciatic nerve looks like, right? Imagine an on-ramp to a freeway, okay, and you have several on-ramps. Let's say there's 5 or 6 of them, okay, and then you have one freeway, okay? The freeway itself is your sciatic nerve. The on-ramps are these things called nerve roots. Anytime you have sciatica, right, it means that anywhere along the sciatic nerve, which is the freeway, or those roots, you could have a blockage or something causing pain.
Pile up on the freeway.
Pile up on the freeway. So the accident could be at one of the on-ramps, and you've got to figure out which one of those it is. Or it could be right in the middle of the freeway. And it could be at the top of the freeway, it could be at the middle of the freeway, it could be at the bottom of the freeway.
Could be down in Mesa.
Could be, exactly. It could be the 202. So whatever happens when sciatica is diagnosed, it just means pain in leg, right? That's kind of a big catch-all misnomer. And so that's why it's so frustrating for people to kind of like pinpoint the diagnosis. It could be pain in the back of your leg, pain in the front of your leg. So when it comes to accurately diagnosing sciatica, we have to identify like which of the nerve roots there's an issue with, and is that because of the joint being compressed by a muscle? Is that muscle overactive because of patterning, which is what we already touched on? And then how do we undo that to relieve the pressure on the nerve, right? Because when it comes to treating sciatica, and why a lot of treatments are hit or miss, and you might get an effective dose from this cortisone shot and not from this one, is because there are many, many, many different places that sciatica can actually come from, and that is different from the root cause, which is a lot of the times rooted in how the muscles are moving the body, right? So sciatica, especially when it comes to like pregnancy, has come to mean anything that causes pain deep in your glute or in your back
or lower.
And lower.
Yeah,
right.
I see that, and that's kind of one of my pet peeves on these Facebook groups and people soliciting advice from people that they should not be soliciting advice from. People are having pain that is starting on their back and it's going places.
Yeah.
Right? Working towards a diagnosis of what that actually is, I think, is hugely important, and not just lumping it into that sciatica catch-all phrase.
Right.
Because that does a disservice to the patient. It also does a disservice to what method of treatment is going to be best to actually get them out of pain.
Different methods for each type.
Yeah. Something that we talked about on the podcast last year was kind of some considerations of different ways that you have to work with pregnant people, and kind of talked about the fact that a lot of things like laying face down isn't really possible after about the 20-week mark, right? Because you've just got this large mass on the front. But I think one of the things that people don't consider is laying flat on your back, right? There's a whole bundle of vasculature in there that, as the uterus becomes larger and compresses on, you can impinge blood flow to and from the legs, that sort of thing. So positioning during the day or during sleep, how can that affect kind of back pain and how you need to kind of consider working with a pregnant person?
So it depends on what back pain this person's already having, right? Absolutely. So if they're already having some sort of back pain, like laying directly on your back puts different pressures on the SI joint and on the vertebrae in the back, because the baby's got to rest somewhere, that can elicit or worsen or exacerbate any sort of back pain or SI joint pain that's already going on. But equally, if you lay on your side and you don't have a pillow between your legs, the crossover that happens between your legs can also place pressure on your SI joint and cause different curvatures in your spine, which can aggravate things. So I think one of the biggest things, at least from my wife's experience recently, has been the pregnancy pillows that they have, and really just like stuffing something underneath your stomach, under your belly, right? So that it's supported, so it's not pulling you over into that position, because I think sideline is definitely the easiest position to be.
One of the only options at that point.
Absolutely. And so I think that sidelining is probably the best in terms of like comfort, but you also have to take into consideration putting a pillow between the knees.
So the last thing I kind of want to touch on is something that we've talked about before, that common versus normal, right?
Great.
And I think one of the things that happens a lot for women is incontinence following pregnancy and childbirth, right? So talk us through a little bit about why that might be happening and why that shouldn't be happening.
Right, so this is kind of a pet peeve of mine, interestingly enough, because so many people at first my clients, they won't share it with us, right? And then after we get more comfortable, it's like, I didn't tell you that this was happening, but now it's stopped happening, so I'm going to tell you about it. So I started asking people more pointed questions, like whenever they come to me with these symptoms after pregnancy, and it turns out like it's very, very common, right? And I think that at first they seek help, right? They ask their OB or whoever about it, and it's normalized. This is something that happens to everybody, and then they start asking their friends about it, and everybody's like, oh, me too, that happens to me too. Ever since I gave,
I pee a little bit.
Yeah, every time I sneeze, I pee, or every time I lift weights, or every time I jump up and down, right? And so it's like no more jumping up and down or sneezing or
Ever.
or laughing, right? Just take all the fun out of it. Not only did you do this enormous athletic event, but you can't have any more fun, right? So I think a big issue is that a couple things. So women who do bring it up are either told that it's normal or that one of the only fixes for it is pelvic floor physical therapy, right? Which does have a time and a place, right? But it is not the only way to fix incontinence because of childbirth, right? Incontinence that's due to childbirth. So the big thing is that a lot of people don't know that you can fix incontinence without doing any internal examinations, which makes a lot of people uncomfortable, right?
Yeah, I was going to bring that up. I think that's one of the reasons that even if a woman is fortunate enough to be referred to physical therapy or pelvic floor physical therapist, sometimes they don't ever go because of the internal exam, right? People carry histories of trauma, histories of abuse, where they don't want to be subjected to another internal exam, right? So let's talk about why that may not be necessary.
Well, so it all starts with the core, right? So, and let's just back up and remember that, like, the baby is delivered through the vagina, right? You urinate through your urethra, right? There's no logical reasoning that states that, like, a childbirth trauma has to affect how you use the restroom, right? So this all comes down to abdominal pressures, right? So if you do have anything going on in the SI joint, or something is a muscular pattern that isn't working correctly, let's say that you had a cesarean section and you don't really know how to use your transverse abdominis very well. So when you do things like cough or sneeze or jump up and down, your core isn't creating the appropriate pressures, so you may even overbrace, right? And that, in essence, like, causes differences in pressures and may make you urinate, right? You also don't have when you're at rest, you're supposed to have a tonic resting activity that stops you from doing that, right? And if your core is inactive because of these structural abnormalities that may happen, whenever you sneeze, it makes sense that happens. So if you fix the structural abnormality and then fix the muscular patterning, that goes away, and that doesn't need internal examination in order to be able to do it.
Right. So I think we kind of touched on a few times the disservice that's done to pregnant people, right? It's a so fast issue. I think the point of this whole series is just really empowering women to stop equating common with normal, and give you the right questions to ask. And if you are asking these questions of your provider and they're telling you that it's normal,
find a new one.
Find a new one, right? Unfortunately, we see this in our field. Either they don't have time or they don't have the knowledge base to be able to address it, and so it's pushed off to the side.
Right.
And it's not fair to the patient. So you really have to be your own advocate, get your own answers, and find someone who is able to provide you the care that you deserve. Because just because it's common doesn't mean it's normal.
100%. Absolutely. Couldn't agree more.
Yeah. Well, thank you so much, Dr. Tom. I really appreciate your time.
Thank you for having me.
Thanks for coming on. And if you like the content that we are putting together here, if you know that now common does not equal normal, click like, subscribe, share, comment, give us all your feelings, and we hope to see you on the next episode.